What are the most clinically relevant articles in the November 2021 CFP Journal? Hi, I'm Dr. Simon Moore from the Review Course in Family Medicine. We're going to take a closer look at some of this month's most clinically relevant articles, including lung cancer, semaglutide for weight loss, children with cyclic vomiting syndrome, and screening for cancer in women who have sex with women. Let's take a look. Cyclic vomiting syndrome is a good condition to know because it affects 1 to 2% of kids, but it's often misdiagnosed. So if it comes up in your clinic or on a SAMP or in a SU, make sure you ask about family history. Up to half of the family history includes migraine headaches. Now, how do we manage the episodes? Minor episodes, sleep it off or treat them with some minor sedatives like diphenhydramine or chlorpromazine. More severe episodes need to be admitted to hospital for fluids and also for monitoring of electrolytes. Needless to say, this can be a severe impact on the quality of life of these patients, and so parents are going to ask you, how can we prevent it? In kids, data is extremely limited. Adults are often treated with amitriptyline or with topiramate. And in children, there are some small trials with a couple dozen kids that have shown promising results with either of those, though often kids drop out of those trials because of severe side effects.
What are the latest updates in lung cancer screening? There's some new tools out there, PLOCOM 2021, a risk calculator for lung cancer risk. But what are we doing in Canada? Consecutive CTs for 3 years for those who are at high risk. And who's high risk? Who are we screening? Those 55 to 75 years old using low dose CT. And why are we screening? We're trying to pick up those cancers that we can get early, because lung cancer accounts for 25% of mortality from cancers. So what can we do? We can pick up those cancers early and decrease mortality. Read the article in this month's CFP Journal.
Do semaglutide injections help reduce body weight? The Tools for Practice crew took a look at this in the November 2021 CFP Journal, and here's what they found. Injectable semaglutide, subcutaneous 2.4 milligrams a week, does help most people lose weight. About 70 to 80% of people will lose about 5% of their body weight or more. In fact, the average amount of weight lost is 10 to 15% of their body weight. They compared that with placebo. Placebo patients only lost 2 to 3% of their body weight in these RCTs. And this effect was spread out over 68 weeks in some of the longer trials. So, what's the cost and what's the downside? It turns out a lot of people have side effects, gastrointestinal side effects. We're talking 75% of people are going to feel gastrointestinal upset, but it's not severe enough that it makes them stop the medication, which is probably a good thing, seeing as how if they did stop the medication, they gain the weight back. There's not a lot of evidence when it comes to preventive screening in women who have sex with women, which is why there's a great article in the November 2021 CFP Journal which covers this topic. Issues such as cancer screening, diabetes, domestic violence, these issues are specifically mentioned and some common misperceptions are addressed. For example, common misperception, women who have sex with women don't need to have pap tests. Turns out that is false. They do have HPV. It rates up to 30% in one study, that's in lesbian and bisexual women. Another study found that women who have sex with women who report never having had heterosexual contact still have HPV rates up to 19%. So for that reason, do follow cervical cancer screening guidelines for your province and your patients who are women who have sex with women. Thanks for joining us for the November 2021 CFP Distilled. Please take a look at thereviewcourse.com if you are interested in monthly updates on family medicine topics, or if you've got a CCFP exam coming up, we're there to help you prepare.